So good morning, my name is J. Mark Eric Escobar, your student nurse for today from BSN 11N. So for today's video, we'll be demonstrating eye assessment. For the eye assessment equipment, we should have a alcohol for sanitation, pen light, and working gloves since we will touching the skin of the patient to avoid cross-contamination. And first, we need to ask the patient information. So, good morning, sir. I am J. Mark Eric Escobar, your student nurse for today. Can I have your name, sir?
My name is Leo Monero.
Okay. Your age, sir?
I am 15 years old.
Okay. Your birth date?
I was born in November 22, 2006.
Okay. So, how would you like me to call you, sir?
You can call me Leo.
Okay, sir Rio. So, sir Rio, for the procedure, we just need to relax and sit. Okay. So before we start, we need to close the door and close the curtain to ensure the privacy of the patient. So before we start, we need to do the proper hand hygiene. So sir, are you using any contact lenses or eyeglasses?
No.
Okay. Just gonna put my gloves on. So now we need to test the eye of the patient using the Snellen chart, but the patient should be 20 feet apart from the chart. So sir, you see the chart?
Yes.
Okay. You need to cover your one eye to check if you can clearly read the first line of the chart. Can you read the first line, sir?
Yes.
Okay.
Yes.
So now going to proceed to the next test. So sir, I'm going to raise my hands and tell me how many fingers I am raising.
1, 2, 5.
Okay, so now next proceed to the next test. Now I'm going to use pen light to check the patient eye light perception. Okay. So next we're going to sit front in the patient 2 to 3 feet apart. So sir, I'm going to raise my hand and wave and tell me to stop if you already see it.
Stop.
Okay.
Stop. Stop.
Okay, just look straight into my eye. So now we'll be checking your right eye and left eye separately. So sir, can you cover your right eye? Okay. So just tell me to stop if you already see it.
Stop.
Okay.
Stop.
Just look straight into my eyes.
Stop.
Okay. Your left eye, sir. Can you cover your left eye? So just tell me to stop if you already see it.
Stop.
Okay.
Stop. Stop.
So the next thing that I'm going to do is to inspect the eyes of the patient if it is symmetry or asymmetry. So sir, now I'm going to palpate your eyes. Is it okay with you? Okay. Can you move here? So close your eyes, sir. Okay, it is symmetry and no discoloration. So the next thing that I'm going to do is to palpate to check the lacrimal gland and lacrimal sac for swelling of the patient. So sir, we're gonna palpate. Okay. So the next thing we do is to ask the patient to look up, and I am going to depress the lower lid of the patient. So sir, can you look up, sir? Okay. So now I'm going to invert the patient eyelids to assess the perebral conjunctiva. So now I'm gonna use the pen light. So, look down, sir. So next, I'm going to check the pupil and the iris of the patient. So sir, just look straight into my eyes. Okay. So next, I'm going to check the patient cornea and lens for opacities. And I am going to check its clarity and texture. So I'm gonna use my pen light. So the next thing that I'm going to do is to turn off the light or darken the room partially to check the patient pupil and shine a light if they have the same light reflection. So
Yan na pwede pa.
So now that the light either room is darkened, we'll now check the patient eyes.
Hindi rin ang gano'n. Talo ka mo. Pero patay na naman.
So after checking the eyes of the patient, turn on the lights again. So now I'm going to ask the patient to look first at the tip of my pen light and then my back. So sir, can you look first into my tip of my pen light and then look at my back? Okay. So now I'm going to do the Hirschberg test and use my pen light and look for consensual reaction. Now I'm going to ask the patient to follow the pen light without moving his head. So sir, follow the pen light without moving your head. So now I'm going to proceed to summarization of information obtained during the assessment.